हाय एवरीवन। दिख रहा है ऑलरेडी कमेंट्स हैं यहाँ पे। गुड टू सी पीपल जॉइनिंग इन। हाय गाइस। गाइस जैसे जैसे आप ज्वाइन कर रहे हैं प्लीज कीप ड्रॉपिंग अस हाय एंड लेट अस नो इफ दिस इज द फर्स्ट आईपीओ इंटरव्यू दैट यू आर वाचिंग या फिर आप एक रेगुलर फॉलोअर हैं हमारी सीरीज के। वील जस्ट वेट फॉर अ मिनट और टू फॉर मोर पीपल टू जॉइन। I'm sure everyone's very excited to start the interview. Please keep dropping us a hi in the comments. It will be good to see that. Okay, let's start. Hi everyone and welcome to 5paisa's YouTube channel. मैं हूं आंचल पाठक और आज हम बात करने वाले हैं रेनबो चिल्ड्रंस मेडिकेयर के आईपीओ के बारे में। रेनबो मेडिकेयर एक मल्टी स्पेशलिटी हॉस्पिटल चेन है जिसका आईपीओ इशू 27 अप्रैल को ओपन होगा और 29 अप्रैल को क्लोज होगा। कंपनी को इस आईपीओ इशू के थ्रू 1580 करोड़ रेज करने हैं। द इशू comprises fresh issue of rupees 280 crore and an OFS up to 2.4 crore equity shares. The price band is set at rupees 516 to rupees 542 per equity share. Joining me today is Dr. Ramesh Kancharla, Chairman and Managing Director, Rainbow Children's Hospital. Sir, thank you so much for joining us. How are you doing?
Thank you very much. It's nice of you to invite me. Thanks a lot. Thank you.
It's great to have you here, sir. So, सबसे पहले I would like to start with, can you tell us about the thought behind Rainbow Children's Medicare and the journey of the organization?
No, I'm a pediatrician trained in India, and I was also there in the UK for 8 years' time. So during that time, I was just I was exposed to some of the world's best children's hospitals in London. So what I've seen is that there is a need of children's healthcare in this country to be developed to the advanced level. So I saw an opportunity in Hyderabad city, came back and started working towards it. So in the last 20 years, with a team of doctors, we were able to build a large chain of a pediatric multi-specialty hospital chain with the obstetrics as well. So what is it's just not a children's hospital. It is a children's hospital to save the sicker children and also the intensive care work for newborn and pediatric children when they become very sick. And all the specialties like adults, neurology, nephrology, gastroenterology, all those things. And also do deliveries within the children's hospitals. We always believe that best place to have a childbirth is children's hospital. So it's a larger format of what we used to call as a MCH, larger format of maternal and child health. So that's what we do.
Right. And how many doctors do you work with currently?
So we have about 600 full-time doctors, and the almost 60% of them are senior doctors. Very similar to my background. Most of them are actually trained in this country and also outside, Canada, UK, and other places. And for the training the specialties and come back and join our network. Right now we have hospitals in Hyderabad, Bangalore, Chennai, Vijayawada, Visakhapatnam, and New Delhi.
Right. That's quite impressive. So, Doctor, obviously my next question to you would be the IPO issue. How do you plan to use the proceeds?
So we have a fresh issue of 280 crores, and 280 crores are going to be used to 170 crores are going to be used for the expansions plus medical capex. So we have about 500 beds planned in the next 3 years of expansion. So we have NCDs, the debt from the CDC with the 41 crores is going to be repaid. Rest of the money is going to be for general corporate purposes. So we have a 200 crores on the balance sheet. So we have a sufficient cash flows for the desired expansion process.
Right. And the 500 beds that you're adding will be across the cities that you're operating in, or are you thinking of opening up in newer cities?
I think Hyderabad is a matured hub and spoke model. We have one large multi-specialty hub and 4 spokes. The Bangalore is tracking very well, the hub and spoke model. So we need more spokes in Hyderabad because there is a demand. So Bangalore, it's going very well. So we are adding more beds in Bangalore. And Chennai is again, we have done extremely well, 2 more spokes in Chennai. In Delhi, we are looking at as a NCR as a kind of cluster. Wow, we are looking at
Right,
it. We are exploring to start a hospitals in Gurgaon and Noida.
right, right. Any plans of expanding further north or nothing as of now?
We have a plan to expand in the northeast, which is Guwahati. That is an early third process that may take time to kind of establish.
Materialize. Right, right. So, talking about the industry that you're established in, can you give us an outlook of the industry, and also how are you stacked up against your competition and who are your main competitors?
See, we are in the maternal and child health space. There's no definitely like to like a competitive player at the size where we are operate. But however, there is some maternal healthcare chains like boutique centers, which dominantly they compete with us in the birthing space. So
Right.
children's space, not much of competition. There are sparse here and there, some children's hospitals like Surya in Mumbai and some trust segment like Gangaram in Delhi. Those are the hospitals are there. Not in the private segment, very similar to Rainbow.
But can you tell us like what the outlook of the industry will be going forward? Can you give us an idea of that?
I think what is as per the Crystal reports, what the maternal and child health industry is going to grow to about $36 billion in the next by 2026. About almost kind of $22 billion is going to be the pediatrics and obstetrics. The pediatrics is going to grow at 14%, and obstetrics is going to grow at 12%. That's a huge. When you look at the developed countries, that growth rate is about 5 to 6%, which is almost
Right.
kind of the 3 times more growth. And also, there are significant factors now for us to grow is that nuclearization of the families. So India has taken a huge revelation in terms of nuclear families now across the country. So with a large number of nuclear families, young people working, and also lots of jobs in IT and various other industries, and also health insurance and awareness also. So most of the corporates today gives a health insurance. So in our business that we have about 50%, 50% is covered by the private insurance. So rest of
Right.
the 50% is actually out of cash. Over a period of time, more and more insurance segment is growing. For example, places like Bangalore and Hyderabad, almost we are reaching to 60% is a private insurance. So that indicates that there's more demand going to come for the children's healthcare and also obstetrics.
Right. So, I mean, doctor, this is like a very non-IPO question that I'm going to ask you. Like, considering the story that you've given me regarding the journey, how you identified that there was a gap in the market, it seems like this is something which is not just your work, but also something that you're very passionate about. And now the company will be going public. So, uh, any thoughts there? I mean, like turning your passion into like a working business model, and now, such a big step. What are your feelings there?
Yeah, we are passionately built as a kind of hospital, madam. We never looked at it as a business from the first 10, 15, almost 15 years time. Yeah, since we had an investor, so obviously I had to look at it as a business also. But at the same time that, we have delivered great for investors also. They've been extremely happy. They've been with me for 9 years time. So with the equity what actually we raised, we were able to grow very well. And also that in year on year, we've been growing very well. For your information, we've been giving a dividends for the last 10 years uninterruptedly. So we've been
Right.
PAT positive almost like a good decade. So therefore that, once the old water goes and the new water comes in the form of a public shareholding. So I'm sure, I would look at the similar way of how I see my investor, because it's important that, people who trusted and invested to build this business have to get the returns as well. I am sensitive about it.
Right, that's good to know. Before we close the interview, is there anything else that you would like to say to your future investors?
I think what's important is that we need to build this healthcare model for future, because children is something very very different, because they are basically healthy. Unfortunately, they fall sick with various conditions and also
Right.
infections. If you can treat them at right time, so they can come back to normal health, they could be like anybody else. So at the same time, what people kind of not expected is that how a children's hospital could be viable. This used to be questions to me in the beginning when I was trying to raise the funding, but I dispelled all the myths because there's a great need of children's healthcare. And also today's the young India is very different. People are actually looking at a smaller families, less number of children, 1 or 2 children. They would like to take care of the children, and they are our future. So I'm sure now in this endeavor, then people will actually be happier in contributing as well as kind of benefiting from their investments.
Right. Thank you so much, Doctor. It was a pleasure talking to you. All the best for tomorrow, and we'll definitely see you soon. Thank
Thank
you.
you. Thank you. Thanks so much. Thank you.